Hi there, John Cummins from Executive Medicine, and we have a special guest here, Pierre, who is an optometrist and an orthoptist from what I found out today. So one of the things that we often focus on here is generally, as we're all aware, preventative health, but one thing that's really important is visual health. And typically when a person reaches the age of 50, I like them to see or have some form of visual assessment either through an optometrist, orthoptist, or maybe an ophthalmologist. Because what we're really interested in is finding the hidden eye diseases that can impact your vision and possibly cause blindness. So macular degeneration, cataract, diabetes changes, and glaucoma. So I'd like to introduce Pierre, who's enlightened me about some aspects of eye health that I was not aware of until now. So if you'd like to say a few words, Pierre, about visual health and your role and your particular expertise.
Yeah, thanks, John. Look, prevention is the best form of cure. So a lot of the eye conditions have no symptoms. Glaucoma takes your vision. It's a thief at night. So we promote having an annual eye check if you're over the age of 50, and that can be done with your ophthalmologist or your optometrist. It's nice to get that tick of approval. There are supplements you can take for macular degeneration now. There are supplements you can take for dry eye if you suffer from dry eye. So don't put up with your eye symptoms. Get professional advice, and we can certainly help you. Then, if you once you've had your general eye check, if you need specific optical filters or sunglasses, then your eye care practitioner can advise you accordingly. So you can have polarized sunglasses, you can have non-polarized, you have different tints and colors. You can have daily contact lenses just to be used for occasional use during a sporting environment or a round of golf. You can have contacts that are multifocal in design, where they give you both reading vision and distance vision. And then you can wear any sunglass you like. So we're living in an era where there's so much advances in eyes that don't see it as a deficit. Speak to an eye care practitioner, tell them what your issue is, and they'll come up with a regime for you to help you.
Pierre, one of the things that I was fascinated to hear is what you find or what you do in sport and vision and eyewear. So can you tell us a bit more about that? I've never heard of some stuff.
So if I can use the example of a cricket wicketkeeper. Now they will have exceptional vision, but coming around a day-night game, that white ball has scuffed coming off the pitch, and all of a sudden they can't pick up the flight of the ball coming off the pitch. So you'll see cricket wicketkeepers wearing yellow or orange lenses to enhance the contrast and the target. So basically, when I'm looking at human performance, if you tell me what your visual limitations are, I will come up with a solution for you.
And does this apply to a lot of other sports, like for example cycling or soccer or archery or whatever people do?
Across the board, yes it does. Yes it does. So my aim is I examine the athletes, speak with the coaches, understand the visual importance of that particular sport, and then advise them accordingly.
Yeah. So of our clients who do a variety of what middle-aged people do, who should think about seeing you that's particularly interested in, I mean, a lot of our clients are, relative to age, is still involved in sort of reasonably high level performance. Who should speak to you about enhancing their performance? But could it be runners? Could it be people that, which situation should they think of seeing you?
Well, I'm sure you've got a lot of golfers.
Yep.
And are they doing their visual system justice for the 18 holes? Are they concentrating for 18 holes? And if not, why? And there's a number of things you can do for golfers.
Like what?
We can develop vision training programs if they're having problems with their depth perception.
Okay.
We can offer them the right optical filter if they're having glare off the greens. So there's I'm not going to do skill acquisition. I'm not going to teach them how to putt.
Sure.
But I'll certainly make sure that their eyes are functioning to the best of their ability.
Yeah.
For the 18 holes.
And what other sports could that? I mean, I'm thinking about a cyclist, for example. You know, different glare. They're in a pack. Things are moving quickly.
So, for example, in cycling, you really can't wear polarized lenses because you won't see the potholes.
Oh,
So we need to make sure that they're wearing the right optical filter.
didn't know that.
Yeah. So there's very specific requirements, say, for cycling.
Yeah. Running, marathons, or distance, or
you could wear a whole cross range of optical filters, and certain brands have done their research. For example, Ray-Ban Oakley would have their specific filters for cycling, for golf, for running.
Wow.
And so my aim is to make sure that we get the right frame that's comfortable, like fitting the right shoe, and then the right colour, and making sure that they fit well and they can wear them for the whole day.
Okay. In tennis and things?
Tennis would be optical filters again. It'd be eye movement patterns also, the way they're using their eyes. And obviously eye-hand coordination for tennis is also...
Which you can do with the SVT technology.
Yeah, correct.
Yeah,
correct.
Great. All right. Well, look, hopefully that's helpful. I've certainly learned some things and makes me realise how much I don't know. I didn't realise you can't see potholes with polarised lenses. But if anyone would like to see Pierre, then certainly we have his contact details and we'll get them on the link towards this little YouTube clip as well.
Please get your eyes tested.
Okay.
Great.
Thanks, Pierre.
Thank
Great
you.
to catch up.